afternoon, everybody. Welcome to our question and answer time with the media and with the community about what's happening with COVID-19 in the Eau Claire area. We're glad that you join us and continue to seek the right information and the information that is coming from the health department and from across the state related to the updates on COVID-19 for not only what we're seeing related to cases, but also the most recent updates. So thank you. We appreciate that. There's been a lot going on, both locally and nationally, as well as at the state level. So we're happy to share that with you each week when we get together for this Q&A session. It struck me this morning as I was talking to a colleague that it is only 2 weeks from what is, for many people, the celebration of Christmas Eve. It's only 2 weeks away from today. I would encourage you to keep really paying attention to how we can keep disease spread slow in the next number of weeks, that we pay attention to supporting our local businesses as we approach the winter holidays, where many people are fortunate enough to be able to buy small gifts for one another, that we think about doing that with our local businesses that have really struggled during this time with COVID-19, and that we really spend time reaching out to people in the community. Winter is a tough time, and we'll talk a bit more about this in a minute, but it is a time where we now, even more importantly, need to be reaching out and extending just that personal connect with one another. We'll start with our state status update like we always do. We'll share with you some state data, some local data, as well as some updates that have happened this week. And then we will go into the questions that were already shared with us in advance by the media. And then certainly we'll answer additional questions after that. So at a state level, we are now, for the number of negative test results that have been received from Wisconsin residents, at more than 2.2 million negative tests, almost 55,000 additional negative tests done since last week. Our total cases of COVID-19, so people that are Wisconsin residents that have COVID-19, is now at 426,099. So a good portion of our population that has tested positive, an increase of almost 6,400 people in Wisconsin that have tested positive for COVID-19. Of those people, almost 19,000 of them have ever been hospitalized. Greater than 1,000 people, 1,134 people have newly been hospitalized in the last week for COVID-19. We now are at 3,944 Wisconsin residents that have died related to COVID-19. Really amazingly large number of individuals and their families who have been impacted. Almost 400 new deaths this week. The state 7-day positivity rate, those number of positive tests by people tested, is at 28.7% this week. And our positivity rate by test, so taking all tests as a single entity in the denominator, is at 12.3% as of yesterday. Again, those positivity rates are considerably higher than what our goal is across the state. In Eau Claire, we are now at almost, at 39,458 negative tests for COVID-19. So that's how many tests have been run on Eau Claire County residents that have been negative. Almost 1,000 new negative cases, new negative tests since last week, Thursday. We are now at 8,326 individuals that are Eau Claire County residents that have tested positive for COVID-19 since the start of the pandemic. An average of about 52 cases a day for the past 7 days. Moving in the right direction, as you'll hear me say, related to much of our data. Still a very high per day case count. Our positivity rate in Eau Claire by test is at 12.3%. We're now at the same space for positivity rate that the state as a whole is at. And we now have more than 7,400 people that have recovered from COVID-19 or completed their time when they are in isolation and potentially infecting others. We are working still with 788 Eau Claire residents that are actively in isolation or are staying home because they are have the potential of spreading disease. In addition to those 788 individuals, all of their close contacts are also being quarantined in order, again, for us to slow disease spread in our community. Of the individuals that have tested positive, 257 of those have been hospitalized, an increase of 9 people since last week, Thursday. And we now are at 65 Eau Claire residents that have died related to COVID-19, an increase of 6 people since last week, Thursday. There are now 66 active COVID-19 investigations happening in Eau Claire County. That's the data that is tracked at a state level. You can find those reports on the state website. Those include long-term care facilities across our community, as well as educational facilities, group housing, workplaces, and healthcare facilities. The state rating for COVID-19 activity level in Eau Claire County is at the very high level. Again, if you go to the state website and you look at the map, you do see some significant changes from critically high to very high levels of COVID-19 in many counties across the state. The goal with very high is to have over 360 cases in 2 weeks. We had in the past week 791 cases in that 2-week period. At the very top end of being in that very high category rather than the critically high category, that's at 1,000 cases or more for that 2-week period. But it's coming down, and that's really good news for our community. Our goal is to continue to bring that number of cases per 2 weeks or per day down to a manageable level so we have slow spread of disease. We know if we have fewer cases, we will have fewer hospitalizations, and those hospitalizations will result in fewer deaths. So that really continues to be a really important shared goal, is to keep those case numbers low. Again, that goal continues to be 10 cases a day or 150 cases in 2 weeks. So we're at 791, well below the more than 1,000 cases in that 2-week period that we were at a couple of weeks ago, and certainly moving in the right direction. Thank you to everybody in Eau Claire that's been working on that. It's made a difference. We need to keep testing to know that our case numbers are remaining low. If we don't test, we don't know that. So we need to make sure that we are testing and slowing spread by making sure that those that test positive stay home. We have more to do, but we're moving in the right direction. So thank you to Eau Claire for seeing the seriousness of the rapid uptick that we had in November and paying attention to that. We also weekly share with you a couple of other data points. Our jail testing data as of Monday was at 344 individuals tested that were connected to the jail, with 22 positive and 21 recovered over that time frame. UW Eau Claire connected cases make up about 16% of all of our cases since the beginning of September, and we continue to work with UW Eau Claire to not only track cases that are UW Eau Claire connected, they are also doing work like the school districts are to help identify close contacts to those cases and really make sure that isolation of positive cases and quarantine of those close contacts happen so we can slow spread in both the UW Eau Claire setting as well as the K through 12 school setting. People in Eau Claire may not realize that the work that that partnership has resulted in is really work that has prevented large outbreaks in schools, both K-12 as well as higher ed. Other places across Wisconsin have not had that same outcome. They have not worked as hard on the mitigation strategies and on the disease investigation and contact tracing for a variety of reasons. Um, and they have had larger school outbreaks. We've been really fortunate in Eau Claire that that partnership has resulted in lower numbers, and it's important because that means we have kiddos staying in school, and that's really critically a priority for all of us. Couple of announcements that have happened this week. The state and the Centers for Disease Control at a federal level did review the data and evidence and determined that it was, while remaining the gold standard to stay home for 14 days, to quarantine for 14 days following a close contact to a case, that gold standard that we've had in place since the beginning of the pandemic. Evidence shows that the risk of ending quarantine a bit earlier was seen as resulting in a possible change that would be available to people that were able to keep distance, wear a mask, and monitor their symptoms. So new guidance came out last week, Friday. For those individuals that are reliably able to monitor their symptoms, that are able to use the really clear mitigation strategies that all of us are trying to follow. So making sure that distance is maintained and making sure that a mask is worn. That in those cases that a 10-day quarantine was seen as acceptable, is seen as acceptable. So the state and the CDC have moved forward with, again, in those circumstances where mitigation strategies are in place and can be followed, that a 10-day quarantine could happen as long as a person remained asymptomatic during that entire 14-day period. Additionally, for people that are able to get a test, a 7-day quarantine plus a test on day 6 or 7 that was negative, along with masking and physical distance and symptom monitoring, could result in, again, a 7 full day quarantine period rather than the existing 14. It's a bit confusing and complicated. It's not as black and white. There are many if-then kinds of statements in what I just shared with you. And it's important that all of those are followed to make sure that we don't have additional spread of disease because of this change. So the requirement from the state for quarantine did move to, again, 14 days is the gold standard, and 14 days if distance and symptom monitoring can't happen. And if distance and symptom monitoring and a mask can happen, that individuals could then explore the use of a 10-day or a 7-day plus test quarantine. Again, this is important work that we do together. Our shared goal across Eau Claire County is to have disease spread be slow. And one of the ways we do that is that close contacts don't spread disease when they don't realize that they have become a case because they were in close contact with an individual that's COVID positive. So working together on this is really important. And certainly we will have likely ongoing questions about this in the days ahead and are certainly willing to answer those questions. A couple of other updates. Medicare enrollment, the open enrollment period to purchase health insurance plan for 2021 through the marketplace, healthcare.gov, is almost over. Please visit that site before December 15th. Especially if you've had some changes in your experience this year. You may qualify for low-cost health insurance. There is really good help available. If you call 211, they can also help find an expert near you to walk you through this. Again, next Tuesday is the deadline for that. This is not a COVID-specific issue, but certainly having healthcare available to all people in Eau Claire County is a priority for any health issue. So certainly please pay attention to that deadline. As I said earlier, the holiday time period can be tough in any year for individuals. For many, emotionally, it's a hard time of year for a lot of different reasons. Certainly the dark that we experience in this part of the world, and the additional challenges related to holidays, as well as now the added concerns related to maintaining physical distance, even from people we love and care about, all are adding to the need to really reach out and support one another. I know many people are finding creative ways to do this. I see it in the media. I see it as I walk around town. We really encourage people during COVID-19 to understand that this is not just about controlling a communicable disease. It's about supporting our community and doing that in all ways that we can think of. The smiles and the opportunities to reach out in very, very small ways are there every single day. And I encourage you to not get stuck in glass half empty mode, which sometimes all of us can do, but really see opportunities to see strength in this community and help build it by the things that you're doing. There are many resources at the COVID-19eauclair.org website related to mental health and support of people during these times. There's a managing stress tab at that website that we encourage you to go to. And there's also many resources available on all kinds of other sites. So Mental Health America, their national website, for example, has many holiday related resources. We hope people find those resources and use them. Know you're not alone, and know that all of us can reach out to someone, not only to make them feel supported, but also because it feels good to the person reaching out. It will help all of us when we do that. A couple updates from our metrics, those things that we are tracking every week as we go through the pandemic. Again, on our website, if you go to the data portion of the website, you'll see our red, yellow, and green metrics there. They get updated and will be updated on Friday with more new information from the last week. Couple of highlights though. Testing has been lower, so we know many of you have noted that. We hope people continue to understand that testing is one of our key strategies for dealing with COVID-19. It's been down in Eau Claire and it's been down across the state. So please seek testing if you have any symptoms. Please get tested if you are a close contact. Again, close contacts are encouraged to get tested sometime during their quarantine period. There is testing available in Eau Claire County on every day of the week, and we have wonderful resources in this community. Just a note that the National Guard testing site is continuing at its current location, but we will be likely changing the location of that National Guard free testing site. And as we get that information, we will be making sure that it is available on our website. Do check our website before you go to the National Guard testing location in the weeks ahead to make sure that you're getting to the right place. The percent inpatient hospital beds is in a better spot. We're at 77%, and that percent of inpatient beds is decreasing, which is really good news. Again, a success in our community of really slowing spread and decreasing hospitalizations. Um, we also know that healthcare is facing shortages in staffing because of COVID-19. So we need to make sure our numbers of COVID patients remains low. They need to have the ability, and they do have the ability now, but they need not to be stressed by this, to treat all of the things that we go to the hospital for. So we need to keep working on that and making sure that they can do their job in a way that meets everybody's needs. We had 11 new outbreaks in the past 2 weeks. That is an indicator that's in the red. Our community spread indicator remains in the red at 35%. And we are improving in our public health measures, those measures where you really need us to be contacting cases and contacting close contacts as quickly as we possibly can. It's getting better. We're now at 69% of the cases that get a call from us in the first 24 hours. It's probably clear to all of you that the fewer cases we have to call, the more likely it is we can get to it within the first 24 hours. We've added staff and we continue to work on making sure that those calls are quick and effective. But it does take time. So we need people to answer their phone and we need the case numbers as low as possible. It's getting better though, so that's good news. Our capacity right now only allows us for doing contact tracing or the contact follow-up, those people that have been in close contact with individuals in some very specific ways. We are not able to call all the close contacts still, given our case volume. We're working with schools, UW-Eau Claire, CVTC, and other partners to make sure that individuals and those entities are reaching out to close contacts, and that has been really important and helpful work for our community so that people are aware when they're a close contact. And we're also counting on cases, making sure that they share when they're a case with those people that they've been in close contact with. We need to do that for one another when when and if we test positive for COVID-19. We also this week and the last number of weeks, along with the state, have been really working to prepare for vaccination coming. The state is in the primary driver's seat for what happens next with COVID vaccine that arrives in the state. We know that a very small amount of vaccine will arrive as soon as next week. The state will be allocating that out to a small number of healthcare providers, we are understanding, to get started with vaccinating. Again, healthcare workers, those people working in long-term care facilities and residents of long-term care facilities will be the first people vaccinated for COVID-19. It will take a little bit to even get that full group vaccinated. We have many people that are included in that group across the state. Our goal with vaccination and the work we're doing right now is to be ready when we get to the point where mass vaccination happens in a more widespread level. This week, yesterday, we did another flu vaccination clinic where we were testing out some of those mass vaccination strategies. And really enormous thanks and kudos to North High School who volunteered to have an indoor mass vaccination site, a flu clinic site. Yesterday, we vaccinated close to 200 people at that. And it was a really good opportunity to test run some of our strategies to get people through in a vaccination environment. Our goal is to make the vaccine for COVID, when it's available in a widespread way, easy to get and something that we all see as an important strategy to get a little bit back to normal. The more people we can get vaccinated when we have vaccine, the more likely it is that this becomes something that we're not talking about in the way we are now with needing to control spread with the number of deaths and hospitalizations that we've had. We will continue to work with the state as we learn more from them about their plan to get vaccine out across the state, and we'll make sure the community knows what we know about that. An important note is that when we all see the big announcement from the state next week that vaccination is starting, because we do expect that sometime in the couple of weeks ahead, we will receive vaccine in Wisconsin and slowly that will get out across the state. Do remember that it isn't the end of needing to pay attention to those mitigation strategies. Again, we will need to continue to pay attention to that until we have a good percentage of our population vaccinated. And that's going to take some time. So we're going to count on all of us, really count on each other, continuing with distance, continuing with masks while we get people vaccinated. So with that, a reminder, our website, covid19eauclair.org. Also, our call center number, if there are questions, that is 715-831-7425. Please go to our website to look for data, to look for information on testing, to look for information for businesses and other partners on how to support success in those operations. Please look at it for questions and answers to all kinds of questions that you may have related to COVID-19. So a couple of questions from the media that came in advance, I'll answer, and then Audrey, who is monitoring the call today, will help me with questions that come in via chat or come in from all of you that have joined us. So first of all, are we seeing the effects of Thanksgiving holiday reflected in the county's data yet, or will it take more time? Similar question to what we talked about last week. It's been 2 weeks since Thanksgiving, so that initial exposure of anybody that was COVID positive would be showing up by now. Of course, that is dependent on people getting tested, and our testing numbers are lower. Our numbers have been fairly low. So I think the preliminary information that we have right now is that the surge after Thanksgiving that could have happened with large gatherings and a lot of exposure, close contact exposure, doesn't look like it has happened. But again, it could be multiple weeks before we really see that threading forward. So it will count on people that potentially were positive, knowing that they were positive, and those people then letting close contacts know so that they can get tested and find out if they are also positive. If you gathered in a way during Thanksgiving that included close contact with people that are outside your immediate household, please continue to monitor symptoms very closely. Please continue to consider being tested if you were in those situations. It could take time before you develop symptoms or someone else that you are in contact with, if you have no symptoms, getting sick. The best strategy continues to be, as we think about the holidays ahead, is to keep our celebrations to be held in ways that don't result in close contact happening. And we can all do that. It's hard, but we can find creative ways to do that. Another question that came in was, has the health department seen more or fewer influenza cases than it typically does this time of year? So one thing for everybody to understand is that influenza itself is not a reportable disease unless somebody is hospitalized or somebody dies from influenza. So we don't in a typical year get notified of every case of influenza in Eau Claire County, different than what's happening with COVID-19. So that may be something that not everybody understands, but we don't get case numbers for influenza the way we do for COVID-19. There are sites across Wisconsin. They're called Sentinel surveillance sites. They're sites where they are watching for COVID-19, for influenza cases. And they are monitoring to see whether or not it appears that we are having more cases this year than other years. So they take testing data and in real time look at testing data volume and positive volume at some select locations around the state. We haven't gotten reports at this point that we are seeing largely different influenza numbers, but we're hopeful that that will happen. And it's certainly something that is potentially anticipated given that we are doing really all those right things, washing hands, staying home when we're sick, keeping physical distance, and wearing a cloth face covering. That likely would help with influenza spread as well. We've typically averaged only 1 or 2 influenza hospitalizations between October 1 and December 10th. That's one of those things that's reportable to us. Some years we have more. It's unpredictable depending on the type of influenza that is circulating and how good of a match it is to our vaccine of the year. But that will be one of the things that we'll be able to report on in the upcoming months is as we see hospitalization rates for influenza shift, we will certainly be able to share that as we know about it. It's early in the season for influenza, and as we have more data, we'll be sharing. Our hope is that we have a low season of influenza because people got vaccinated and because people use those basic slowing down of disease spread strategies. I know we talk every year about washing hands and staying home if you're sick, and this year, more importantly than ever, do we have that in place, need to have that in place. If you have not gotten your flu shot, get it. it's still time to do that. It's not too late. Please get your flu shot if you're someone that hasn't gotten it. It will help in so many ways, not only with not getting influenza or being less likely to get influenza, but also will help in decreasing the number of people that are potentially hospitalized because of influenza. And we need to keep those hospital numbers low. So I will pause and ask Audrey if any other questions have come forward.
Yeah, we have a follow-up question about vaccinations. You mentioned that the first doses are expected to arrive in Eau Claire County as soon as next week, and those will go to long-term care facility residents and workers. Do you know about how many doses Eau Claire County is going to get, even if it's just a rough estimate?
Yeah. So first to clarify that the state will be receiving dosages from the feds as soon as early next week. It will take some time for those doses to get out to places across the state. So we know that that process will take a bit of time for the spread of that vaccine to go from the state level to the local level. Um, at this point in time, there are some broad estimates of how many doses the state will be receiving, but we've gotten no indication of what doses will be available at the local level. We also don't know if, for example, all counties will be getting a small amount or if there will be prioritizing where some communities, at least to start, will get the initial doses. So that's part of what we're working through with the state. And as soon as we have more information, we will absolutely be sharing that. It is our understanding that, again, um, healthcare systems, those healthcare workers that are most directly working with COVID positive individuals will likely be prioritized. So I would anticipate that hospitals might be the first place that gets vaccine. But again, we will see that as decisions are made once the vaccine arrives.
There aren't any other questions in the chat box, so is there anyone who would like to unmute and ask a question directly?
All right. Thank you all for your time. We really appreciate you joining us to get information from the health department about what's happening with COVID-19. We will be back next week, Thursday, and update you again with data and with the newest information we have at that point in time. We anticipate that it will include updated information related to vaccination as well. Thanks again. Have a safe and healthy week, and we look forward to you joining us again next week.